Okay, let's do fluid and electrolytes. I want to talk about the most common labs that people order and why. So I'm going to talk about CBC, I'm going to talk about BMP, and then I'm going to talk about coags. This might be a three-parter because I love to talk. Let's go. By the way, this graphic comes directly from my course and resource and book called The New Nurse Survival Guide. If you're struggling as a new nurse, let me help you out. Go to my website, link in the bio. Vamonos, let's start with CBC. Let's start with white blood cells. All right, so white blood cells, WBCs, you know that you have 5 types. High levels can mean that you have some type of infection or inflammation. Low levels mean like, oh shoot, you're at like a super high risk for infection. Next is red blood cells. Red blood cells carry oxygen through the body. They also eliminate CO2. Makes you think of like respiratory acidosis or alkalosis. RDWs is the size of your red blood cell. If you have differences in sizes, it can mean different types of anemia. Next, hematocrit. This is the portion of the red blood cell in a certain amount of whole blood. High levels can mean dehydration. Now, hemoglobin. Hemoglobin is the oxygen carrying protein of the red blood cell. So, low levels usually are indicative of bleeding. They will order this test if they are checking for bleeding. Next, we have mean corpuscular volume, MCV. If it's high, it has to do with like acid levels and sometimes B12 levels. Next is the platelet count. Platelets are the cells that help in blood clotting. Low platelet levels can actually cause more bleeding. So if you're doing hemoglobin and hematocrit to test for bleeding, they may test for platelets. They may infuse platelets as well. And then mean corpuscular hemoglobin is how much hemoglobin your red blood cells actually have, and that is your CBC. Memorize the values. Trust me, after you've been working for a month, it's gonna get stuck in your head and you're just gonna know this, but memorize them for school and for the NCLEX. Part 2 is going to be on BMP, but that was CBC. Love you, bye.